For many aspiring nurses, there's always this dilemma on whether to go to a school of nursing or to go to a university. In this video, I'm going to be comparing the school of nursing and university. And as someone who has gone through both processes, I'm going to also give my opinion and what I think about it. Hi guys, welcome back to my YouTube channel. Please subscribe and please watch the end of the video. So there are two pathways to become a nurse in Nigeria. The first one is School of Nursing, which used to be 3 years training, and then you get your license and a diploma to practice as a nurse. And then the second pathway is to go to a university, which is 5 years course. You go for compulsory internship, and if you are under 30 years, you go for NYSC. But for School of Nursing, recently, NMC has mandated all the schools of nursing to become colleges of nursing such that they can give their students HND at the end of the training. So it's now 4 years for schools of nursing and still 5 years for university. The first factor that I'm going to consider is the cost of nursing education in the universities and schools of nursing. Remember, schools of nursing are now 4 years from 2025 and universities are 5 years. And I'm going to be using public universities because private universities and private schools of nursing, their prices can vary differently according to their location and just so many factors. I'm going to be using public, federal and state universities as my comparison. So for schools of nursing versus universities, I personally think that schools of nursing, even though they are state owned, they are more expensive than going to a federal university or a state university. So on the aspect of cost, I think schools of nursing are generally more expensive. Another factor that I'm going to consider is the ease of getting admission. As far as Nigeria is concerned, this is a very big factor because we all know how difficult it is to get admission into higher institutions. Not just getting admission to study what you actually wanted to study. So in Nigeria, I don't think that we have enough universities that are actually offering nursing as a course. For example, in Rivers State, there are only two public universities that are offering nursing, and I'm not sure they even admit up to 1,000 per year. So which means that the nurses that are able to produce in universities every year is not able to meet up to the needs of the population. So what happens is it becomes very competitive. So if you have ever tried to actually get admission to study nursing in university and you couldn't, it's not because you are dumb, it's because it's actually very competitive. There are limited slots for loads of people that are coming to study that course. So when it comes to ease of admission, I personally think that schools of nursing are generally easier to get into than universities. And that is because we have more schools of nursing in the state than we have universities that are also offering nursing. And also, before 2025, we didn't really require JAM to get into schools of nursing, which means that in 1 year you can buy like 3, 4 schools of nursing and then you write their entrance exam and then see which one you pass and then you get into one of them. But unlike and then universities, you require JAM, so you have two choices, two universities that you can get into. So the next thing I'm going to talk about is career prospect for registered nurses that have either gone to the university or gone to a school of nursing. So if you graduate from a university, you get your bachelor's degree in nursing, you register as a nurse, a midwife, and a public health nurse. That is like standard for most universities. And then if you register as a nurse from School of Nursing, so from 2025, you are going to get registered as a nurse, and then you are going to choose between public health nurse or registered midwife in addition to your HND. So those are like what you are going to graduate with as of 2025. As far as career prospect is concerned, I think that graduating with a bachelor's degree in Nigeria opens more doors for opportunities for managerial roles and specialization, and also into teaching as well if you wanted to teach. But I mean, this can also be achieved by School of Nursing graduate, but it kind of takes you more time to now get your degree and before you can be able to fill into this kind of roles. So the next thing I'm going to talk about is around migration. As far as I know, our education in Nigeria matches up to most countries' curriculum. So it's usually easy for us to be able to migrate to another country after you've been verified by NMC. So for university graduates, it's always they are able to verify their license and migrate to another country. And that is also the same for schools of nursing. As far as I know, most countries also accept school of nursing certificate for migration. Although some countries like Canada, the process is a bit longer or different if you don't have a degree. But for other countries, it's usually just the same thing. I mean, I migrated in the UK before I eventually did my BSc. So for generally, it's not a problem going to a school of nursing or going to a university if you eventually want to migrate. So, having considered all these factors, I'm going to tell you what my personal opinion is. Take notes. I am a registered nurse. I graduated from School of Nursing in 2017. I migrated to the UK in 2021, got my degree, and I've been practicing as a nurse since 2018. So this is what I think. So if you're 17 years old, just finish your WAEC, you are just trying to write your jam, get into school, and you are in between choosing both either of them. What I think is just go to the university, write your jam, see if they give you admission, go to the university and get your degree. But if you have done this like two, three times, because it is actually difficult, we don't have enough universities to accommodate everybody. If you've tried to get into the university for like 3, 4 years, and then now you are trying to give up, or you now want to go and do a totally different course in the university, far from what you ever wanted to do, I think you should go to a school of nursing and become a nurse. And also, let's say you are in your 40s trying to get a second career in nursing. I don't think you really have all the time to write jam 3, 4 times trying to get into a university. In that case, you can just go to a school of nursing, graduate, and see what happens from there. And if you're a registered nurse that graduated from School of Nursing, or you're a student nurse still in School of Nursing, and you're wondering what you should do post graduation, this is what I think. If you want to practice in Nigeria after you graduate, go ahead and get your degree. It's going to help your career. But if you have any plans of not practicing in Nigeria, what I think is after you graduate, save money, that money that you are supposed to use to go and start a 4 years degree program, or that 1 million naira you want to go and do that critical care, peri-op, ophthalmic specialty training. I think you should instead save the money to write the exams that you will need to travel outside the country if that is what you plan on doing. Why I'm saying is because most of us get into this trap of you finish School of Nursing and then you find out that, oh, I don't have a degree. Then you try to like match up, you go and start getting yourself into doing specialty courses. You do ophthalmic nursing, you do pediatric nursing. Like those courses, they actually cost millions of naira, and it's like for 1 year or 1 year and 6 months, and then it costs you millions of naira to actually do them. And then in the end of it, what you actually wanted to do is that you want to travel outside the country. I mean, if you want to practice in Nigeria, you like this specialty, it's different. But if you wanted to practice in places like the US, what they require from you is your license and your degree or your diploma. And then if you wanted to work in any specialty, what you need to do is apply to work in that specialty, get the experience from that specialty. And if you wanted to further your education, then that's it. But it's not a requirement for you to actually get these specialty courses before you can travel, if that is what you wanted to do. Don't waste your time if that is what you wanted to do. And then also to get your degree in most countries, if you already have a diploma, it's like 1 year, at most 2 years. But in Nigeria, it's going to take you another 4 years of your life trying to get a degree. And from my personal opinion, I think that you do not need 4 years as a nurse who has been practicing or who is already registered. You don't need 4 years to actually get your degree. I mean, most people will not agree with me, but that is just the fact. I've gone through the process, and I don't think it should take anybody 4 years to get their degree if they're already practicing as a nurse. Finally, what I'm going to tell you is that whichever pathway you've chosen to, or you are already into, whether you are in the university or you are in School of Nursing, make sure you are giving it your best. Put your best, and you would always see the result. And thank you guys for watching. Please subscribe to support my channel. Bye bye.